Vanakkam, Namaste and welcome to Dr. Shah's clinic. In this video, we're going to answer the question, what causes erectile dysfunction in young men? Now, this is a very important clinical problem we are seeing in practice today. Now, and let me tell you one thing very clearly. In the past, we used to see erectile dysfunction predominantly in older men, or at least that's what was happening, because a large number of younger patients who used to come to the clinic were usually sent away without a proper sexual function assessment or assessment of erectile function. What used to happen in the past, at least in the clinics world over, was that when younger men used to go to the clinic, either the doctor would not ask the patient about his sexual function or erectile function, or a proper evaluation was never even done, or if the patient came with a complaint of erectile dysfunction or erectile disorder, the doctor would assume that it's only a psychogenic problem, it's all in the mind, and used to send the patient away. What basically happened was a large proportion of older men were only being treated for erectile dysfunction and were systematically investigated and managed. So much of the early data, over the last 20 years is based on information that we have from an older population of men who are over 40. But today, there seems to be a sudden drastic shift in the patient population that's visiting sexual health clinics. And today what we are seeing is that almost 1 in 4 men or 1 in 5 men are visiting a sexual health clinic for erectile dysfunction. So patients are wise enough and as well as smart enough and are well informed enough to know that they have some problem with erectile function and that it's not strictly all in the mind as it was originally thought to be. In fact, there was a study which came in the Journal of Sexual Medicine published in the year 2013. It came from an Italian university, and the paper evaluated 790 European Caucasian men for erectile dysfunction, all less than 40 years of age, and they found true new onset erectile dysfunction in up to 55% of the population. That means 1 in 4 men who had visited that particular department of urology in that college actually had ED, new onset ED, which was not previously diagnosed. Even today in Chennai, in my own clinic, in the last 2 years, I've seen at least over 2,000, 3,000 patients with erectile dysfunction, and almost 70% of them are patients who are actually younger than 35 years of age, and this is a very scary picture. There seems to be a sudden or a drastic change in the social demographic characteristics of patients who are visiting the clinic for sexual health assessment, and today younger individuals are being diagnosed with ED. And similarly, there's data coming from all around the globe that states that in young men the prevalence of ED can range anywhere from about 18% all the way up to 55 and even 60%. And erectile dysfunction is no longer strictly a disease of the older population. What are the causes of erectile dysfunction in young men? I'll tell you some causes from my personal experience as well as some causes that have been published in the scientific literature. First, smoking seems to be one of the major causes that's leading to atherosclerotic changes in the artery supply to the penis, and that's causing erectile dysfunction. So excessive smoking, excessive drug use, cannabis, marijuana, cocaine use, drug abuse, illicit drug use is also another cause of erectile dysfunction. So smoking and drug abuse usually go hand in hand. Both are very common causes of erectile dysfunction in young men. Third is excessive alcohol consumption. That's some young men take alcohol thrice a week, 4 times a week, and they combine it with alcohol as well as drug abuse. That's another cause of erectile dysfunction in young men. Fourth is most of the time with much younger patients, who are less than 30. What we're seeing today, at least in the major urban cities, is that they have difficulties in finding stable partner relationship or stable partners. So men tend to shift between multiple partners before they settle down, with one partner. We are kind of mimicking the Western European culture of as far as mate selection is going. So today men are being more open, they are more experimental, and there are live-in relationships. In general, overall stability in partnered sex has actually come down, and this can also lead to psychogenic erectile dysfunction. And a man may have good erectile function with one partner who he finds physically attractive, and he may not have a good erection with another partner who may also be physically attractive, but some other temperamental trait or some other trait in the partner might actually put him off. So it's very difficult. So psychogenic erectile dysfunction is very common in young men or the younger male population. So, and that's probably also an important factor here is that there's a lack of stable partnered sex or lack of stable partner relationship. Then there's another problem. Young men are also doubtful of their own orientation, and that is also contributing to erectile dysfunction in partnered sex. That's another problem that we're seeing in the clinic. Some of the young men are yet to take a choice on their orientation. They have obsessive doubts about their orientation, homosexual versus heterosexual orientation, and that also leads to erectile dysfunction. And today what we're also seeing in young men is that when there's a failure, maybe they tried sexual intercourse for the first time with their partner, whether it's married, unmarried, it's a different story. First time sexual intercourse might have become a failure. A vicious cycle builds up. The second time also becomes a failure. There's overall performance anxiety, and performance anxiety is a major cause of ED in young men. Performance anxiety issues with sex is also associated with depression and also lower self-esteem. So men who have lower self-esteem have lower self-confidence, they are more depressed, and they have erectile dysfunction combined with anxiety disorder. This is something we are again seeing very, very commonly in the clinic, at least in our clinic, and this is also being reported from sexual health clinics around the globe. So that's another cause of erectile dysfunction in young men. At least in Chennai, or at least here down south, what we are seeing is a large proportion of young men, less than 35 or less than 30, also have diabetes and also have dyslipidemia, and these are two well-validated causes of erectile dysfunction even in the older population. So diabetes, hypertension, dyslipidemia, that is elevated triglycerides, elevated cholesterol, combined with metabolic syndrome and erectile dysfunction, is usually seen in a combination even in young patients, at least in our population. On an average, I would estimate that 1 in 20 or maybe 1 in 15 individuals at least who come to our clinic, I really have to look at the data for a more accurate representation. We tend to pick up either diabetes or hypertension or cholesterol, which is hidden, and the patient would have never even known that he has these conditions before, and then he would also have concomitant ED because of these conditions. And lifestyle factors, so working in a night shift job, working in highly stressful jobs, and interpersonal conflicts, domestic misunderstanding, a lot of psychogenic factors are involved in causing erectile dysfunction in young men. So I hope you enjoyed this short video on what are the causes of erectile dysfunction in young men. What's important to bear in mind is if you have a problem, kindly reach out to me below and drop in your questions below, drop in your comments. Please like and subscribe, and don't worry, erectile dysfunction is actually treatable. It's not a major problem. I'll be making a lot of videos on the topic. I'll be giving you diet chart tips and a lot of things to help you cope up with the problem of ED. So I hope you like this video. Please share it with all your friends and loved ones. This is Dr. Shah, and we'll see you soon with another.